So now I want to talk to you about how low-risk individuals and high-risk individuals should be conducting themselves in their daily lives going forward. We know for a fact that young people have a much lower likelihood of dying from this virus, and that the primary spreaders of this virus are young people in their 20s. We also know that people at high risk are people that are 65 and older with other health conditions. Now, I've heard young people say, I'm not going to die from this, I don't care, I want to go out and get it and be done with it. And I don't think that's really an unreasonable stance, except for the fact that there is an incubation period of about 10 to 14 days where you don't even really know you have it, and you may be spreading it before you even get symptoms. So if you're a healthy person, low risk, and you're not worried about getting it, what I would caution you about is that it's not you that I'm worried about, it's the 80-year-old grandmother that you have that you might give it to at a family get-together who's going to die from it. So it is still important for young people to practice social distancing and masks and that kind of thing when they're around anybody who's high risk. So if you want to go to the beach with your friends and you get exposed, or maybe you don't know you've been exposed, I would really stay away from anybody in your family who's high risk, because you might be incubating that virus and spreading it to them. On the flip side, if you're high risk and you're seeing these numbers spike and you're really scared, you just have to practice the same lessons that you've been doing for the past couple of months and just be committed to doing it for over a year. And really that's the answer. You're going to have to wear your mask when you go out in public. You're going to have to keep at least 6 feet of distance from everybody. You're going to have to use hand sanitizer. And when it comes to family get-togethers, you might have to do it via Zoom or Facebook until we have a lid on this thing, because if you've got some young relatives that are getting together and they're not being careful, they might be spreading it and you might get it. So that's something real to think about. And thankfully we have the technology that you can still interact with them, not personally, but at least you can see each other until we get a lid on this thing. But if you're high risk, that's the concern I have for these folks that are going out there and not thinking about it. So in our medical clinic, I can tell you that I'm not worried about getting the virus personally. I just don't think I'm going to die from this thing. But we have about 200 patients per week coming through this clinic all day, every day. Many of them are 80 to 90 years old. And so what I'm thinking every day with every single patient is, what if I have it and give it to them? So I wear my mask all day. I use hand sanitizer all day between every patient. We're washing everything between everybody. We're keeping our distance. And that's the attitude that healthy people or low-risk people should have towards everyone else. You have a responsibility to not give it to them. You're right, you're probably not going to die, and we actually need you to develop herd immunity, but you still got to engage in those best practices to keep those folks healthy. On the other end, if you're high risk, just treat everybody like they've got the virus and keep doing what you're doing. So I hope that helps, and we'll continue to give you information going forward. Thank you.